So the other factors that impact a patient's outcome or their ability to kind of recover from a traumatic brain injury, there are many factors. The ones that we're going to talk about, kind of the big factors that impact outcome would be the amount of actual damage, immediate damage from the insult or the impact. A low initial Glasgow Coma scale, which is one of the scales they use, especially in the eye opening and the motor response category. So that's considered a factor in your outcome. The cumulative effect of any secondary brain damage, any damage to the brain secondarily from the impact, an individual's premorbid cognitive characteristics also impact their outcome. What was their intelligence before? What was their cognitive function, their education, their memory? Kind of what was their baseline level of cognitive ability? The presence or absence of substance abuse, and pre-injury personality, including the quality of interpersonal relationships and work history. So those are kind of the big factors that can impact a patient's outcome following a traumatic brain injury. There are two major classifications of brain injuries. The first one is called an open injury. That means to be considered an open injury, the skull has been fractured and displaced. So this results from a penetrating type of wound, like a gunshot, where a bullet goes into the skull and fractures the bone. A knife or another sharp object has made contact with the skull and fractured and displaced the bone fragments. We see with these folks, we see the damage to the brain follows the path of the object, right? So if, depending on where that bullet or knife enters the brain tissue, how far it travels through the brain, does it come out of the brain, that the path of that object is where we see the brain damage. These types of injuries also result in more focal deficits. And what we see, of course, when we have a skull fracture means the meninges, as you recall with the neurology lectures last year, the meninges are those three layers of protection that run over the brain. And when you have a sharp object like a gunshot or a bullet coming into the skull, those meninges are compromised. So therefore, there's an increased risk of infection, right? That bullet might have bacteria on it. The knife wound might have a virus on it. And also you have, as that bullet, let's say, or knife travels through your hair or the victim's hair and the victim's skin, you could be bringing in, infection from the victim's hair or from their scalp and entering into the brain tissue. So we also have bone fragments, we have skin and hair that can be penetrated. And so now that brain tissue is exposed to a variety, has a potential to be exposed to a variety of risks. So this is just a picture, just to give you a visual of, if let's say a stake or something went through the skull, you would have, bone fragments, and you'd have all this exposure to the underlying brain. Just another visual here, not to be creepy, but just to give you an idea of really the location matters. Right, this victim, obviously something went right beside their eye. So along the course of whatever that sharp object is, it could have impacted, let's say the optic nerve, could have impacted their sinuses, It clearly went through maybe the temporal and the parietal lobe. It went through the frontal lobe. So we could have all different functions of the brain could be impaired. So we'll pause there.